The Honourable Parliamentary Secretary.
National Trade.
Thank you, Mr. Speaker. I will be splitting my time with the member for Argenteuil-La Petite Nation. It's a pleasure and an important challenge for all of us to discuss the motion tabled by the honourable member from Wetaskiwin, thank you, related to autism spectrum disorder. I would like to thank the honourable member for his ongoing efforts in raising awareness about the needs of individuals and families affected by autism spectrum disorder. Many, many Canadians are dedicated in the same way in which the honourable member is, and today is a significant day on their behalf. Dr. Glenn Davies is another champion. He says that the prevalence of autism is accelerating at an alarming rate. In 1975, just 1 in 2,500 children were being diagnosed. Today, it is less than 1 in 100. He goes on to say, the next set of solutions will be at the convergence of a wide variety of disciplines and include families, communities, and a wide range of thinkers. No one group can do this alone. Communities, schools, healthcare systems, and governments must work together. I believe it is in this spirit that the member has brought forward this motion, and it is in this spirit that networks are being built across the country. This is precisely what the government is assessing at this time, as we engage with many groups to identify potential opportunities for partnerships, and as we engage with other departments to determine where investments can best help those with autism and their families. I would like to take this opportunity to talk about the Pacific Family Autism Network in British Columbia, which has been envisioned and built through an inclusive and collaborative process including families, individuals with autism spectrum disorder and related disorders, clinicians, community professionals, researchers and representatives of government within the framework of the Pacific Autism Family Centre Advisory Committee. The Pacific Autism Family Centre is a family-first model. It is the first of its kind in Canada and North America. At the centre, key organizations are brought together under one roof so that everyone is working together, sharing information, and ultimately supporting families. Autism BC, the oldest organization in British Columbia, is central to the hub, as is the Autism Support Network, the Provincial Ministry of Education, and the Provincial Ministry of Child and Family Development. Autism Speaks is a major funder and partner which focuses on research and is highly supportive of this model of collaboration. The Miriam Foundation provides resource materials and information with the intent of delivering the best service to every individual. The Seneve Foundation is another partner whose vision is that every adolescent and adult in Canada with autism spectrum disorder will be supported in realizing their highest quality of life. The fact of having these partners under one roof makes life so much easier for families and their children. The 60,000 square foot centre is the vision of Wendy and Sergio Coquia. Sergio also serves on the previous government's Canadian Autism Spectrum Disorders Alliance. The province of British Columbia gave a huge boost to the centre through a $20 million capital contribution, followed by a significant capital campaign. At the centre, there are service providers, medical and dental practitioners, a partnership with UBC to train healthcare professionals while in university to become aware and comfortable with people with autism. The centre has a preschool where 50% of the children are on the autism disorder spectrum and 50% are not. Behavioural analysts are being trained. Apart from the significant funding the federal government provides to some of these research and support partners, the centre also partners with the federal government to deliver the Ready, Willing and Able and Employment Works programs. Ready, Willing and Able helps employers across British Columbia to hire people on the spectrum and to sustain them on a permanent basis. Employment Works works on the other side of the equation with individuals themselves to connect them to placement opportunities. The Pacific Family Autism Centre is leading Canada in job placements. Having just started in January 2016, there are over 100 people in permanent positions today. It is going so well that they are being contacted daily by parents who wish to be part of this program on behalf of their children over 18. The centre also reaches out to companies to participate. For example, SAP has a mandate of hiring 1% of its staff from people on the spectrum by 2018. The collaborative model is serving families. Informing researchers and families is a second pillar for the centre. It serves as a hub for research. Supported by first-class technology from TELUS, this research model is a two-way form so that research is going directly to families and families are informing new research. Again, this is at the heart of our government's approach. Thirdly, the centre is building spokes out from this hub. New, smaller locations are opening in British Columbia. A small one has opened in Williams Lake and a more major one in Prince George. Bringing services together, providing first-class information to access to information that is available at the central location, and expanding adult programming is very important in parts of the province and indeed the country that are more remote. Equal access and inclusion is a critical aspect of public health and healthy communities, and those who need it most should be our top priority. Living away from urban centres presents challenges that the Pacific Families Autism Centre strives to address. The network believes that autism is a condition that affects whole communities. As such, we need an integrated solution that includes community education, teacher learning, the training of specialists, more awareness for medical practitioners, and support for siblings, parents, and extended families. Governments can't do it alone. The Pacific Autism Family Network is about coming at this together. It's about saying, let's pool our resources and work with governments to get out in front of this issue. Let's be the leader and show the world how this could be done. For our part, the federal government is making significant investments each year to support research focusing on ensuring that children and adults affected by autism spectrum disorder and their families have the best support and treatment possible. Over the past 5 years, the federal government has invested close to $40 million in research through the Canadian Institutes of Health Research. Canadian researchers are recognized as global leaders. At the Hospital for Sick Children in Toronto, the Autism Genome Project is comprised of researchers from more than 50 research centres across 11 countries. As the world's largest research project on identifying genes associated with the risk for ASD, our government continues to make significant investments in research and innovation in the last 2 federal budgets. In Budget 2016, the federal government announced a new ongoing investment of $30 million per year to support investigator-led research through the Canadian Institutes of Health Research. This investment represents the highest amount of new annual funding for discovery health research in more than a decade. As I went over this speech this morning, today's debate was on, of course. For the most part, it would be very difficult to say which party was speaking. My Conservative colleagues talked about a shared leadership model and putting research into practice and bringing all of the initiatives into one place, and I could not agree more. Mr. Speaker, our government is reviewing the important work of the Canadian Autism Spectrum Disorders Alliance to this very end. There are other significant efforts underway. One is to create a national autism strategy under the leadership of one of our senators. Another is the major effort from the Medicare for Autism Now network to advocate for health care funding. These are important voices too. Members of Parliament clearly care. Today's debate is important. On behalf of the families in my riding, many of whom are leading the charge, as is the honourable member, I am confident that our government and the Ministers of Health and the Ministers of Families, Children and Social Development and other ministries involved will operate within a collaborative model to improve the lives of those living with autism spectrum disorder. Thank you very much.